Backup integrates with Antari Home Care, a telemedicine platform designed to monitor the progress of patients with chronic illness. Clinicians can use it to introduce multiple measurements and results of tests, and visualize the evolution of primary and secondary health parameters. The stratification test is a brief questionnaire that can be administered in the first contact of the patient with neck or low back pain, based in 10 simple questions, which helps to classify the patient in 3 risk groups: low, medium or high risk. This provides a base estimation of risks to keep suffering pain, having poor function or being absent from work at 2 or 6 months, based on evidence from clinical trials, and also provides the recommended treatment options for this patient. These treatments can be included as part of the activity plans of the patient, who may receive this information at home, and keep in track with the clinician. From home care, the clinician can also access the visual representations of the prognostic models generated by Backup for different aspects of health and work with the data obtained from the patient. There are models that predict the intensity of pain and level of disability in the next weeks and months, as well as the probability of work absence and time to return to work. For the case of people who suffer neck pain due to whiplash-associated disorder, other models use the results of biomechanical tests and responses of the patients, and estimate how pain will progress in the next weeks, or whether their reported level of pain and disability might be biased, in the case that the clinician is concerned by the influence of insurance claims. For instance, we can see intuitive and eye-catching graphs that show how probable it is for a patient to be less or more than 4 weeks out of work, taking into account their answers in the questionnaires, and also see the probability of high pain and disability or poor function in the next 2 or 6 months.